If you are having teeth like this, it's nothing to worry about anymore. We are here to help you out. Don't worry about if your teeth are bad. You don't need to shy them out. You don't need to cover yourself. We have ways to help you out and fix it for you. And you can eat anything, whatever you want to, with a beautiful smile. If you are thinking whether you are a good candidate for getting fixed dental implant dentures, definitely come stop by. We're gonna do a 3D scan, completely complimentary for you. That's when we can see the bony structures under and what is the width, what is the size, can we do implants and all, can be evaluated only by looking at the 3D scan of your teeth. And by looking at the gum health and everything, we can decide and make a plan for you. People always find for easy solutions and cost-effective solutions, but they don't know what they're losing by doing that. If you think you just can take off whatever's broken in there and just get a regular denture in there, you are definitely doing something wrong. Regular dentures, it just keep falling off. You got to keep using glue, and after a few years, even the glue doesn't work anymore. So that's not a good way to go. Even though it's cheaper, it is going to come back to you with a bigger cost later down the lane. When you have just a regular denture, it is not sitting on anything and the bone is going to go away. After 10 years, the same person comes back to us and tell us like, hey, dentures are not working anymore. But we know about it ahead of time, and that's not a good solution to do. You always should have something in the bone, either teeth or implants. So once you have implants in there, implants will protect your bone. It doesn't go away, so you can get implant dentures put on the implants. That'll give you more stability to chew. More confidently, you can talk to people and smile.
Of course, saving your teeth is always a little bit more affordable. However, dentures, partials always have the con when it comes to the bone loss and other issues. Affordability wise though, it is, yes, of course, cheaper, and your insurance does tend to cover that. Implants is a permanent solution to what you've been going through. So it is the best form of treatment for you, but of course with best does come the cost.
The other most common question we get is how long does it last? I usually tell my patients it will last as long as you take good care of it. You got to follow the instructions that we give you, do proper home care. You don't want to go back south like your other teeth did. Our average guaranteed time is 20 to 25 years, but it can definitely go longer than that. And if you are not a smoker and if you are willing to come back to healthy habits, it will definitely last very long for you.
Another big one we get is, oh, they look so fake. Well, yes, there is, some maybe truth to that, is the fact that they are fake teeth in your mouth, but they do not look like that at all. They are not chunky like dentures. They are not popping in and out of your mouth. These are fixed in your mouth. They are customized to look and feel like your teeth from texture, shape, and size. And the color. And the color is a big thing. So you can pick all of those things. You can customize it, and it can look like your teeth. It is going to look like beautiful smile. It's life-changing. And why are you not calling me yet?
And if you have any old pictures which you want to really get those similar teeth, we can also do that. Bring in your pictures, zoomed in pictures, and we can try to get the same smile for you.
Yes.
There are some patients who really bought us the pictures and which has the gap in between the middle teeth. Some patients wanted longer teeth. We work with you. We customize it to you how you like it.
Of course, everyone's saying it's so expensive. No insurance covers it. That is a myth. There is insurances that cover implants. Of course, it is not going to cover 100% of your treatment. Nowhere is, unfortunately, but there is insurances that help you with the payments. Anywhere between $2,000 to $7,000 with some insurances. So another question we always get asked, how much is it going to cost me, right? I have price lists that are here that I give to each one of my patients that come in here for a free consultation. We have plans that start as low as $10,000 for implants, but they can go as high, of course, as $50,000. That's just a broad range. Every case is different. Every patient is different. Come in here, get your free consult, see what's going on in there, and take the first initiative, take that first step, make some life-changing decisions.
So let's go over the step-by-step process. When you first come in, you'll meet Tabitha. She is our financial consultant. You'll go over all the financial discussions with her. If everything's okay and we do some scans and we do some treatment plan for you, you agree on it. Next visit will be the data collection visit, where we collect all your scans, we do some more x-rays, some intraoral pictures, and we make a perfect plan for you. And the next step is the very important step, the surgery day. It's a pretty long day. We start early in the morning at 8 o'clock, and then it can go somewhere between 2 o'clock in the afternoon to 4 o'clock in the evening. We do the surgery that day, and then you will go back same day with fixed teeth in your mouth on the same day. The next step is then you'll come back in 2 weeks for a post-op visit. We want to check how everything's healing, and then we'll bring you back in every 2 weeks just to make sure things are going right for you and you're not breaking any denture anywhere. And then after 3 months, we'll take a new scan for you. That's when we'll make your zirconia teeth that are stronger. It takes a couple post-op visits to come in to check everything's going well. And then once your zirconia teeth in there, you're good. You come back every 6 months just for a follow-up care. We do your cleanings and we make sure everything's nice and clean. We give you any instructions needed. And from there, every 2 years, we want to remove your dentures, clean everything inside, put them back again with, if any parts needs to be changed, the wear and tear of the denture will be taken care. And you're good. If you take good post-op care, it can go very long. If you're worried about the needle pinches, when you get blood drawn, that's what you feel like, the needle pinch. That's the most you're going to feel it. And once everything's numb, you're not going to feel anything. The one thing you're definitely going to feel is the tiredness, because the surgery is a long day surgery, so your jaw will be open for a long time. So you feel some tiredness, but definitely not pain. And we're not that barbarous anymore. We're not working in painful dentistry. We are here to help you out. If there's pain, you just raise your hand. We numb you more, make yourself more comfortable during the surgery. So the risks involved in this procedure, I'll keep it simple. If you don't take care of them or if you don't follow instructions on them, then the risks will come up. Otherwise, it's pretty safe procedure. If you are smoking and if you don't want to quit smoking, then it's a big risk, but that's in our hands to stop it. The other thing is if you're not taking care of it. An implant cannot get a cavity, can never get a root canal, no issues. It just needs to be protected by not letting food stuck under it or around it. So you have to use your water pick every day. We will show you how to use it and all the post-op instructions. And if you follow them, the implants will never get any issues and you can keep them long lasting. The other thing I see is uncontrolled diabetes. That's again, like if you diagnose it early and take medications properly, keeping your diabetes under control is also going to be helpful for proper healing. And if these things are taken care, I don't see a lot of risks involved in this procedure. It's a pretty safe procedure, and we have done a lot. We have seen consistent results, not many complications in there.
We've also given complimentary night guards with this as well, and I go over that as well in the cost appointment. So that'll also help with the clenching and the grinding and protecting that investment.
Yeah, taking home care with water pick and putting your night guard every day is like buying insurance for all the work you got it done here. Those things are done right, it should go long. So the other question we have, what you can eat, what you cannot eat with the denture. I'll explain you the journey of it. When you are on the first day of surgery, we recommend you to be on liquid diet for two weeks. That's the most important time when your gums are healing. You don't want food getting trapped in there. So we recommend liquid diet for 2 weeks. After that, you'll be put on the temporary denture phase for 3 months. You have to be eating softer diet. Anything that you can chew in the consistency of a soft, ripe banana, you can have it, like mac and cheese, mashed potatoes, scrambled eggs, noodles, soups. Very, very soft food like a soft banana, you can eat it in the temporary phase. But when we change it to zirconia, some people end up getting acrylic dentures for the rest of their life. They can eat a little bit better, but not the strongest. Whereas if you go to upgrade it to a zirconia denture, then you can eat whatever you want to. Corn on the cob or anything, you name it, you can eat it. As long as you take good care of oral hygiene care, you are good to go. The other question we get is, does it feel like real teeth? Yes, initially it is very hard for you to understand. Your body needs some time to adjust to it, but slowly, it's a learning curve. You got to take it slow, not just rushing through things, and your body will get used to it. So the materials we use in these dentures are PMMA and acrylic in the temporary part. That is only for 3 to 4 months when you're healing. The acrylic material is not very strong, but when you're healing with the implants in your mouth, you should not be eating anything harder. So we give you PMMA acrylic materials that are softer, that doesn't let you chew very strong food. But once you're all healed up, we move you on to zirconia material. That is the strongest in the dentistry right now. And you can eat corn on the cob, whatever you want to with those final zirconia dentures.
Come in here, get your free consult, see what's going on in there, and take the first initiative, take that first step, make some life-changing decisions.